Tempero-Mandibular Joint Disorders. It's when people clench their jaw too much. It causes pain throughout the face. Commonly associated with certain types of medication like Zoloft is one, but that general class, which is the selective serotonin reuptake inhibitors, which is a type of antidepressant, commonly causes people to grind their teeth at night and causes them temporomandibular joint pain following on from that. It's a bit of a silent epidemic because it builds up slowly. People aren't necessarily aware of it, and they're not aware of a triggering sort of incident, so it just creeps up on them. And I find in the chair quite often people with that issue, they'll open their mouth for me to do something and then it just immediately starts to close. So they have difficulty opening and holding their mouth, and that's a good sign to me that they've got some issue with the temporomandibular joint, if not already, but certainly pending. It's debilitating, and it's not just the jaw, it tends to radiate down the face and neck as well. So I've got some patients here that are really debilitated by it. There's a couple of stages that we go through to try and get them some sort of resolution. One of the main methods that we use is by a class of drug that relaxes the muscles, takes the strength out of the muscles when they're contracting. So there's two issues with temporomandibular joint. One is you've got excess activity in the muscles that close, but because they've got so much tension, the muscles that open have to work really hard as well. So they become fatigued and cause problems. The approach that we use, weakening the muscles that close, we facilitate the action of the muscles that open, so the whole area becomes more relaxed and the tension tends to melt out of the face. Over a period of time, the muscles should weaken because you're taking away the muscle activity. The specific drugs that we use have an effective action that lasts about 3 months, but the pain relief and the relief in the tension of the face tends to last beyond that into the 6 or even 12 months. But I would say in most cases that if we treat them with that medication and that only, they'll be back within a year or so. Clicking and cracking when they open their jaw. Some people make it significant, across the room you can hear it crack when they open their mouth. And that's an indicator that we need to do something, I guess. Yeah, not a very comfortable sensation. Teeth are pretty robust. People that have a lot of reflux or indigestion associated with it can lose a lot of tooth structure very rapidly. But just for the TMJ, if we get it early enough and decrease the bite, it doesn't necessarily need intervention as far as the teeth are concerned. If the teeth are worn flat, and you see that quite a bit, we would probably recommend getting an occlusal splint. There are some other issues that cause the clenching, and one of them's associated with sleep. If people are snoring and having sleep apneas, quite commonly they'll also grind their teeth. So at night their oxygen saturation drops because they're not breathing properly. Then their adrenal system kicks in and they start grinding their teeth. That's a separate sort of issue, and we deal with the sleeping issue first. In which case, in all likelihood, we'll resolve the grinding. But as I say, in the event that there is loss of tooth structure, then it's probably a good idea to get an occlusal splint, which is effectively a wedge of plastic between the teeth to stop them from taking further tooth structure away. If they snore, in addition to grinding their teeth, that's a good indication that they're not getting a good night's sleep. Going through the process of getting sleep studies done is a good idea. Resolving sleep issues will make a significant impact on their life, irrespective of their mouth and their teeth. So if you are a clencher and you snore, don't hesitate, just go and get a sleep study. Your local GP can organise it. They will often come back with a solution which is called a CPAP machine. Some people tolerate it, some people don't. It's the gold standard. It kind of blows air into your face while you're asleep. There are some other alternatives that we offer as well that just hold the airways open while you sleep and can be equally as effective.